Hello, good evening. This is Dr. Grace. I'm pediatrician, neonatologist, and public health specialist from Andhra Pradesh. Today, I'm going to talk on childhood asthma. Thank you, Baby Chakra, for this opportunity. Parents with child who has asthma has got lots of concerns, fears, and doubts. Today, I will be talking on childhood asthma and what a parent with child with asthma should be knowing for proper treatment of the child. Definitely, there is no need to worry because asthma has a good control with proper treatment. There are many Olympian medalists who have asthma and still could achieve such heights. So, there is no need to worry as long as you are under proper treatment. By definition, asthma is a heterogeneous disease characterized by chronic inflammation of airways resulting in respiratory symptoms like wheeze, which is a whistling sound, chest tightness, cough, and shortness of breath, which leads to the decreased expiratory airflow. So when the child is having these symptoms, child will be taken to a doctor and the doctor will ask you about all these symptoms and also whether the child has any associated allergies or there was any trigger, because the cause of asthma is due to the interaction of genes in the body and so many environmental triggers. The most common triggers include pollen, dust, smoke, air pollution, animal dander, cockroaches, molds, and also strong odors. In younger children, even physical activity, exercise, or laughing can act as a trigger. And also, the incidence of asthma increases after some respiratory infections and is common among children who have some other comorbidities like allergic rhinitis, food allergies, and atopic dermatitis. So once the doctor asks about all these symptoms, doctor also asks about family history because the similar conditions like allergic rhinitis or atopic dermatitis can be seen in the child also if the parent is having them. Now we have asked about the symptoms and family history. We will be asking about the frequency of the symptoms. How is the frequency of these symptoms in daytime, in nighttime? Is it causing any nighttime awakenings? And also about any need of admissions for such episodes or flare ups. Once the symptom history is taken, the diagnosis is not requiring any big investigations. The main investigation is seeing the response to the reliever drugs, which increases the expiratory airflow, which we call peak expiratory flow. So once it is diagnosed, and the diagnosis of asthma, the labeling is very important because there are so many other diseases which have similar symptoms. So to diagnose it as asthma is important not only to treat it as asthma but also to differentiate it from some other diseases where the treatment can be something else. Once it is diagnosed, it is important to have a proper action plan of the treatment wherein the doctor will give you the details of drugs, what to use, how to use, and when to use. The technique of using these drugs is very important. We have drugs called controllers, relievers, and add on drugs. The reliever drugs will help relieve the symptoms during an flare up, and the controller drugs, they will help relieve the inflammation ongoing in the child and they will prevent the future attacks. When it is not controlled either by the reliever or controller, we will have some more drugs which we will add on to the already given drugs. So for asthma, we have drugs which can be delivered by very simple devices which can be used at home. The asthma drugs usually come in the form of inhalers, most commonly used in children. Inhalers will be something like this, and you should be knowing the proper technique for proper delivery of the drug, which will help relieve the symptoms. In children, we have two important devices, something called a spacer with a pressure valve. for older children, and for much younger children, we have one more similar device with a mask attached to it. So let's see the technique. If the inhaler or the canister is a new one or not has been used for long times, after shaking it properly, you need to release some puffs outside. And then after shaking, keep it here, one or two puffs as per prescribed by the doctor, and keep the child in mild extension of neck or sniffing position. Tell the child to keep this inside the mouth, covering it tightly, and ask the child to take deep breaths and breathe out. Just like this. It's very easy to tell the child to do this. Tell the child to do ha, hu. So they will definitely do that. It's very easy for the child to understand also. So this technique is very important, because if the technique is not followed, the drug is not going to be delivered and symptoms won't be relieved. So now we, as I have already told, we have relievers, controllers, which are very important in asthma treatment. Now the parent or caretaker should also be knowing about the danger signs, which will indicate the acute flare up of the disease and what can be done at home. The main danger signs parents should be knowing is about increased breathing rate. Breathing rate can be counted by seeing the elevation of the abdomen or chest, and you can also see whether there is any chest indrawing. In between ribs, the muscles will be going in and coming out when the child has difficulty in breathing, and you can hear the wheeze, a whistling noise. But in severe asthma, no wheeze can be heard, and you can see whether there is any bluish discoloration of lips or tongue happening, and you have to see whether the child is active or drowsy. One more thing is, if the child is severely breathless, the child cannot speak sentences, he will speak in broken words. So all these will indicate severe flare up of the asthma. And nowadays, because of COVID, as we all have pulse oximeters at home, you can also check the saturation. So once we have known the technique and danger signs, it is important to adhere to the stick on to the treatment given by your doctor and follow the proper action plan. And the main role comes to avoid triggers. Triggers are different in each and every child. Not every child has same triggers. So you should make note of what is triggering the event in your kid. So when child has a flare up, you need to maintain a diary of what has been done prior to the flare up, any food, specific food taken, or any exposure to cold or any dust or smoke, something like that. You should maintain a diary of those triggers, then you can avoid those specific triggers in the specific child. Avoidance of triggers is very important, because only that can help prevent the further attacks or flare-ups of the asthma. And treatment of comorbidities, as already told, like allergic rhinitis or other allergies, food allergies, is also essential in controlling asthma. So once the child is kept on drugs, on review, the doctor will assess how the drugs are working, whether the symptoms are under control or not controlled. So the doctor will adjust the doses and review the response. The main thing is never ever go for self medication. You should remember this, and instill confidence in the child. Don't get stressed yourself and stress the child. Now, shall we go for questions? How can I prevent asthma attacks in my kid? So, as I have already told, the most important thing is avoiding triggers. Avoiding triggers is the most important thing, and adhering to the proper technique and the action plan that the doctor has given is essential. One more thing I would like to add is on preventing asthma even before it happens in a child, even before the child has symptoms. It actually starts from while the child is in mother's womb. Avoiding exposure to smoke, like avoiding smoking in mother, or avoiding exposure of mother to smoke, passive smoke at home or in environment, will help reduce the incidence of asthma in baby. And it's also been noted that appropriate weight gain in mother decreases asthma incidence. And also it's been proved that normal vaginal delivery and exclusive breastfeeding in child will reduce the incidence of asthma. And child with comorbidities and asthma, it is essential to have a flu vaccine to avoid respiratory infections, which can also act as triggers. So, one more question is what foods should I avoid with my kid to prevent asthma attack? There are as such no specific foods that can be 100% avoided, because each child is specific and the child has specific triggers. So as I already said, you have to maintain the diary of triggers. If child is getting triggered by a specific food, you should definitely avoid that. And in general, it's always good to give fresh home cooked food to the children and avoid anything which has preservatives, because preservatives can act as triggers. One more question is what home care should I take for my 7-year-old when suffering from asthma? Yeah, the home care again includes avoiding triggers, avoiding exposure to smoke and pollen or any other trigger that the child is triggered, adhering to the technique of drug, and decreasing the emotional stress and increasing physical activity is very essential, because obesity in children is also associated with asthma. So weight control is also important. And in home care, we also need to know what we can do at home when the child gets a flare up. The treatment for asthma can start in home itself even when the child has flare ups. As you have been already had that action plan, what to use, when to use, and how to use, you need to use the reliever at home when the child has flare ups. You can use 2 to 4 puffs of reliever every 20 minutes for just 1 hour, even before reaching the hospital. That will relieve the symptoms, and after going to hospital, doctors will assess and add on drugs if at all needed any. So, what precautions should I take for my school going kid when suffering from asthma? It is essential to make schools asthma friendly, by which I mean that the children going to school with asthma should be educated. The older children, especially, can be educated how can they use the spacers or the drugs, inhalers. It is easy to educate the children also. So, and it is also essential for the teachers and caregivers at the school to know how to identify the symptoms or danger signs, and how to initiate the treatment even before the child can be taken to a hospital. So that is about making the schools asthma friendly. And in a child with asthma at school, the problem is comes when the child has to go with the sports. So as I have already told, physical activity and exercise can trigger. If the child has that kind of triggers has been identified, it is advisable to use the reliever medicine 15 minutes before the child is playing or having any exercise activity. And you also have to inform the management or teachers of the school that the child has asthma, and these kind of drugs can be used as prescribed by the doctor, and you have to send the medicines with the kit in their bag. So one more question is my 8-year-old is suffering from asthma and is unable to wear mask when going out. How can I manage this? When the child is breathless, it's really difficult to wear a mask. So the best alternative is to use a properly fitting face shield, and avoid any unnecessary outgoings, avoid any sick people around the child, and make sure every other person is wearing mask if the child is not able to wear a mask. So finally, I would like to tell all the parents There is no need to worry. Just stick on to the proper action plan given by your doctor. Stick on to the proper technique. And important thing is, when the relievers are given, the child will definitely have some improvement. And when parents see this, they think that the controller drugs that the doctor has prescribed are not essential, but it is not like that. The reliever will help relieve the symptoms, but they won't stop the ongoing inflammation. So the controller drugs, when prescribed for some weeks, you need to continue the drugs to prevent further asthma attacks. And also remember, there are many achievers in Olympics who had asthma, so there is no need to worry if the child is having asthma. As long as you are adhering to the proper treatment, child can have normal life and achieve whatever the child needs to. Thank you for listening. Send your queries to Dr. Grace at Baby Chakra app. Thank you. Take care. Happy parenting.